A condition that we're seeing more and more frequently recently is something called recurrent implantation failure, or RIF. What is recurrent implantation failure? It's where you develop embryos, maybe they're even chromosomally tested and we know that they're normal. And then we go ahead and we do an embryo transfer when your uterine lining looks like it's ready. But for reasons that sometimes we don't understand, those embryos don't attach, or they do attach, but then you miscarry early. So that's called recurrent implantation failure. The reason we're seeing that more and more now is because people have tried IVF, maybe other places before they come to see us. It hasn't been successful. Then to see us through the records, and that's what we're finding. So what do we do about recurrent implantation failure? There are basically four levers that we have to pull when we have a situation like this. One lever is to look at the uterus from an anatomic perspective. So we will do a procedure called hysteroscopy, where we pass a little surgical telescope through the vagina, through the cervix, into the uterine cavity. We can see if there's anything in the cavity like a polyp, a fibroid, scar tissue, uterine malformations, and we can then address those and fix those almost always. The second thing we look at is hormonal effects on the uterus. So there are a variety of different tests that you can do for this. One test is called the ERA, the endometrial receptivity assay. Another test that looks at inflammation markers is called the Receptiva test, and there are a couple of other tests as well, but we will consider doing those tests based on your basic circumstances to find out if maybe that will give us the answer. The third thing that we consider doing is we consider putting you on antibiotics in case there's any low-level infection going on inside the uterine cavity. Very low risk to put you on antibiotics anyway. And the fourth thing that we'll consider, which is a little higher risk but not much, is to put you on steroids in case there's any low-level inflammatory process. We do those things, then we attempt another embryo transfer. We cross our fingers and hope that works. Fortunately, the combination of those four levers tends to help and does increase pregnancy rates, but not for everybody. So there's still things that we just don't understand. We're continuing to work on trying to figure out what those are. But trust me, we're taking RIF very, very seriously.